Okay, this is Russ with HealthForward Online, and I'm back here with Dr. Nancy Gardner, and she's going to talk to us again, but this time about breast health and the things that we can do, more of a preventative measures.
Good.
Okay?
Yeah. So, hi, I'm Dr. Nancy Gardner-Heaven, and I've been teaching about preventing breast cancer for about 25 years. I started the California Preventive Medicine Foundation specifically to help educate people about what they can do to lower their risk factors for breast cancer and lots of other diseases. And I'm now teaching a full array of classes on healing burned out adrenals, healing dysbiotic conditions of the gut at San Francisco State as part of the holistic program there. So today I'm doing this for free too.
Okay.
Okay. So this is breast health, and it's teaching women and men too, because men do get breast cancer too. And some of the things that cause breast cancer also cause prostate cancer, like the petrochemicals and such. So this is what you're going to learn, how to lower your risk factors for breast cancer. I do have a video that we can put out later that's how to do your own breast exams. And then, of course, thermography, which we just did a series on that. So there are two factors in the development of breast cancer. One is atypical cells dividing with dysfunctional DNA, and that's called ductal carcinoma in situ. So you can see here, this is a little cross view of inside the duct, and there's little abnormal cells developing in here. What causes this? When you're not getting good sleep, that's when your body goes in and repairs itself. So if you're not sleeping well, then those little cells start to accumulate with dysfunctional DNA, and we want to get you sleeping well. So that's important. And then the second thing that happens is a blood supply develops around feeding that tumor formation, and that blood supply is called neoangiogenesis. So if we want to see the difference between this and when it goes outside the ducts, we're going to look at with thermography, because thermography can see that blood supply developing. Now this is called invasive carcinoma, and so what's important about that is you want to get that out as soon as possible and not let it spread into the lymph nodes. Only if it spreads into the lymph nodes and other organs is chemo indicated. So it's contraindicated, meaning you don't use chemo just for breast cancer. So we want to get that little puppy out, and then we'll work on building your immune system up. So these are the things that avoidable causes of breast cancer is you want to avoid excessive radiation, synthetic hormone supplementation, that's HRT, xenoestrogens, that's estrogen mimicking toxins or petrochemicals, environmental pollutions, nuclear fallout, electromagnetic fields, and excessive meat consumption.
So let's talk about that first one real quick, the excessive radiation. How do women avoid, they may not realize they're getting excessive radiation. What would be the common places they would get radiation?
Oh, well, I'm going to talk to you about that.
Oh, okay, that's coming up.
Okay, that's the next slide.
All right.
Well, but before I do, I want to document that I'm not the only one who thinks this is true.
Okay.
One of the good old boys who was on the other side jumped on this side of the fence, and what happened is Dr. John Goffman, who's an MD and Ph.D. in radiology, head of radiology at UC Berkeley, did a research project, and when he published this, they kicked him off the board. And he published it, and he said they found this information out they didn't want to let us know. It's our estimation that 3/4 of the current annual incident of breast cancer in the United States is being caused by earlier ionizing radiation, primarily from medical sources. However, TSA is getting you to walk through that full body scan, which is going to cause brain tumors and all kinds of stuff. So don't let them get away with it. Just do a little pat down massage. It's just as easy. So these are the things that cause excessive. Way you get excessive radiation is, of course, mammograms.
Okay.
Mammograms are a little bit worse because when you're looking at a bone compared to soft tissue, it's really easy. Like chiropractic and dental, minimum amount of radiation. Although I do recommend pulling that lead plate that they put on you, that little apron, pull it all the way up to the thyroid gland, especially for the children, for their teeth. You want to make sure anytime you're getting a dental x-ray, because they're doing it every year, right? So you want to make sure, and the chiropractic too, just avoid as much as you can. But when you look at mammograms, they're looking at soft tissue, and there's a lot more radiation than they're letting you think there is. So, also job related. Those TSA people who are standing there x-raying us all day long are getting, I've gone through and found out lots of them have breast cancer. So it's amazing. Other exposure to excessive exposure to sunshine, microwaves, and eating radiated foods. So those are all causes of, where you're getting more radiation.
Okay.
Excessive hormone increases the blood supply that feeds a tumor. So where do you get that? Birth control pills and the patch, and now they're putting hormones in IUDs, so you're getting more hormones that way. One of my pet peeves is that they've got us, they're offering women Yaz, and I've seen the commercials where you don't have your period. Isn't that wonderful?
Yeah.
But they don't tell you that they're we're lab rats. They haven't done the research to find out 5 years down the line if women are going to get uterine cancer and not be able to have babies because of that. It's not natural to not have periods. So I don't recommend doing something like that. I think it's really bad for you. Other things, miscarriages and abortions. Of course you can't help it when you have a miscarriage, but I've had patients come in who've had 9 abortions. And that's excessive. So what happens is you get this surge of estrogen to keep the baby happy in your little uterus, and then all of a sudden it's aborted, and then you've got all this surge of estrogen in your breasts, and you're not having a baby breastfeed and clean that out. So it makes you more predisposed to the neoangiogenic blood vessels starting to develop. Other things, fertility drugs is huge quantities because they're trying to get a woman to ovulate who's not ovulating. So they're going to give you huge quantities of estrogen. And then composite dental fillings. So you know how now everybody wants to take the amalgam out of their mouth because the mercury and the metal in their mouth is bad, and they put in the composite. So I hate to be always saying all these bad things, so I want to tell you something wonderful, okay? There is a great product out there called calcium D-glucarate, and it boosts phase 2 of the liver function and cleans all this extra estrogen out. So if you're a woman who's taken fertility drugs and besides taking care of 3 little offspring all at the same time, take some calcium D-glucarate. It'll clean out all that fertility drug. If you've got amalgams in your mouth that you've taken out, for the 2 weeks afterwards, you can take a little calcium D-glucarate, maybe 2 tablets 2 times a day, and it'll just clean all that, boost your liver function, clean that junk out.
Good information.
And then the last one was postmenopausal hormone replacement therapy, and honestly, that's made out of pregnant mare's urine. So it's the hormones that this big, huge horse would need, and they're putting it in our little bodies. And of course, it's causing a lot of problems.
Premarin is what we call it.
Premarin.
Yep.
So you want to avoid that. And you were asking earlier about the different options, and there are bioidentical hormones which are more like your own. But my feeling is it's better to get your body functioning. If you're healthy, there's no reason your body can't make the hormones that it needs. So. And then, so the other avoidable causes is excessive use of alcohol, drugs, and medication. Why? That makes your liver not function properly. And the liver is what's taking the T cells and B cells to fight infection and clean things out. And if it's overloaded with all these drugs, it can't do its job. So you got tobacco, first and second hand, environmental pollutions, hormones fed to livestock, which is in our food, preservatives and inorganic foods, chemicals in household cleaning products, chemicals in cosmetic products. Sometimes they put lead in mascara. They've got black hair dye caused Liz Taylor to get a brain tumor and caused Jackie Kennedy Onassis to have lymphoma and die of lymphoma. So there's a great book out called Safe Shopper's Bible by Samuel Epstein. He's the head of the Cancer Coalition. And they go through all the cosmetic products and they tell you what to look for in it in case yours isn't listed there, and how to find ones that are much safer for you. And just because it's in the health food store doesn't mean it's good for you.
That's true.
There's some stuff in the health food store that's pretty bad. So let's see. So we said chemicals in household cleaning products, chemicals in cosmetic products, including like deodorants. Underarm deodorants have aluminum in them, and dental toothpaste. They're putting sodium lauryl sulfate in it, and now they're putting warnings on it not to let children have it because they'll swallow it.
Yeah.
It's just crazy,
Yeah.
you know. So, and I used to get Tom's. I thought, oh, Tom's, it's wonderful. And now I'm noticing they're putting fluoride and all these things in Tom's. So he must have sold out to some bigger corporation that, you know, wants to get it into the commercial things like Safeway and stuff.
Got to read the label.
Read the label. Yeah, absolutely. And then the other thing is dental infections and root canals infections. This came from a study in Germany where they can tell you every single tooth in your mouth and whichever one's infected, what organ in your body is affected by it. So that was a really neat study.
Okay.
And then there's the electromagnetic fields, and we all know that. But one of the most important things about that I like to say, and especially to parents, is that, you know, it's bad for the kids to sit closer than 4 feet to the TV, and you know how they like to get up there and check out the things going on.
Yeah, or play their Wii
Their
PlayStations.
Yeah, their games. So make sure they're about 4 or 5 feet back. But also, you know, the old type monitors for computers and TVs, the back of them is where the most rays are coming out of. And a lot of times people will set that up against a wall, and the other side of the wall is the children's bedroom and the head of the bed. So you're sitting up late at night watching a movie, and all that electromagnetic field is going right into your children's head. Because you look at these walls, and all they are is little pieces of sheetrock. There's nothing in there. So you just to be more conscious of it. You know, we're wondering why young kids are getting brain tumors and things, and they're not, you know, noticing that.
That's good to know.
So so that's with the electromagnetic fields. So this is my favorite part.
Okay.
How to get you healthy. You want to eat lots of fresh fruits and vegetables, especially green leafy vegetables, nuts and seeds. If you're going to do nuts, seeds, whole grains, beans, and legumes, soak them, because there's an enzyme inhibitor in them that protects the DNA, and as you soak them, it makes it more digestible and absorbable, the nutrients from them. Eat organic whenever possible. Meat, poultry, fish, dairy should only be used in moderation without hormones or antibiotics. And then drink plenty of purified water.
Is that good advice?
Yeah, and I got one more for you. Stress and lifestyle, it's really important. It's just as important as what you're eating is your lifestyle and how you take care of yourself. One of the things that I found I have a PhD in clinical research, which means I'm a little fanatic about reading everything out there that I could possibly get my hands on and finding out which is really good research. And there was a great study that said if you exercise in nature using your deep breathing, which it decreases your risk of cancer of any kind 35%.
That's a big number.
It is. So it's not just the exercise, but it's getting oxygen to your brain. It's being out in nature to help you kind of decompress from a long day's work. So that's 30 minutes a day. So it's not too hard to do. Nurture yourself when you're under stress with aromatherapy baths, massage. I tell my patients to write a list of all the things that comfort them and make them feel nurtured. And then start adding those to their list. And I came up with some of the weirdest things you wouldn't even imagine. I love hugging babies. And just as soon as I put that on my list, actually wrote it down, I tell them, be sure to write it down because it actually gives physical form to you manifesting things. Mm-hmm. The next day, 2 patients came in and they said, oh, while I'm writing down these things you're telling me, hold this baby. Within 24 hours, I was holding babies. So I always like to tell them, be sure to write it down, make a list, and start pulling it in. So nurture yourself when you're under stress. Choose loving, encouraging friends or a support group to help you with your personal goals and your healing. And eliminate unhealthy people, food, and habits from your life.
Excellent advice.
Yeah, thanks. So one last thing for you and how to take care of your breasts. Be loving to your breasts. When you come home at night, take your bra off after working all day and dress in comfortable clothes at home. Give yourself a little mini lymph massage. And on my website, optimonhealthclinic.info, under articles, there's a great article on detoxing the lymph system. And it has a little diagram of how to move the lymph through your body so that you can do a little mini lymph massage. And some of my clients go, Nancy, I don't have time to do that every day. And I go, well, you take a shower. So while you're in the shower, rub yourself the right way. There's certainly plenty enough people rubbing you the wrong way. So you can just do it to yourself. And then keep up your regular breast exams the week after your period if you are cycling, and if not, the same time of each month. And get an annual thermography to catch any changes early. And be loving and positive to your breasts.
So another thing that I was curious about is a lot of women are doing their own self-exams and they find these lumps, and most of the time it's what they're told is calcium deposits, right? And so tell us a little bit about that.
Well, microcalcifications, I think the reason the mammograms really like those so much is they can actually see it. It's hard for them to distinguish the other lumps. But 80% of microcalcifications are benign. And I had the pleasure of talking to a pathologist once. That's the guy who does the biopsies, slices through and finds everything. And I said, well, how many percentage of microcalcification are cancer? And he goes, well, 20% are DCIS, ductal carcinoma in situ. It's a precancerous condition. 80% are benign. And I said, well, what are the 80% if they're just benign? And he said, they're just like gallstones. they're cholesterol deposits. So they're not harmful in any way. A lot of times when you feel through your breast, you can feel graininess in the lumps. I think what mammograms are looking at, if that's atypical, is to see it, and if it's the same each time, it's not getting worse, and it's more developing and getting bigger, that's a sign that it's turning into DCIS. The interesting thing is, though, you can reverse that. And all you do is build up your immune system, make sure you're sleeping better, and you can totally turn it around. As a matter of fact, 80% of my patients turn around with nutritional protocols and helping them to sleep better.
So when they discover this and they go into their doctor and they're told that it's a calcium deposit, a lot of them make the decision to have that lump removed. They just like it out of there. That's not needed. They don't need
Not
to do
at
that.
all. And not only that, but if that may be the only one they found, there may be all over in their breasts, and they may be in both breasts. I mean, you're going to go in there and like a needle in a haystack puncture. Every time you go in and do a surgical procedure, you take the chance of spreading it outside the ducts. So what I would recommend is getting a thermogram and seeing if there's a blood supply.
Okay.
If there's a blood supply, then we got a whole new ball game. And yes, I am proactive in getting that taken out before it spreads. But if there's no blood supply and we know it's DCIS, just get them sleeping better, build up some antioxidants, meaning you build up their immune system, get their immune system functioning. If they're doing anything like drinking a lot of wine or something every night, get them off all that stuff. Get their liver functioning better. And then it'll turn around and get them healthy again.
Okay, thanks.
You're welcome.